So you've just finished your Invisalign or traditional braces, and now we're ready to move on to our retainers. So there are a few types of retainers out there. One is the clear retainer. The other one is a Holly retainer, which is metal and plastic. And then finally there's the permanent bonded retainer. So the clear retainer is really nice in the sense that it tends to be very, very small, and as a result it tends to be a lot more comfortable. And one of the main reasons why we have difficulty with retainers is because some patients, they're just not compliant with it. And if it's not comfortable, generally patients aren't going to wear it. So because you're so used to the Invisalign retainers or Invisalign aligners that you used previously, this tends to be a very easy transition for you to wear that clear retainer. The other thing also is that we make those clear retainer via a digital scan, and that digital scan is saved. So in case you ever lose that clear retainer, what can happen is we can just print your new retainer off of those older digital scans. The other option is the Holly retainer. Holly retainer is kind of the tried and true old method of doing things. I would say the only major downside of that Holly retainer is just that it tends to be bulky. And again, if it's not very comfortable for you, sometimes patients tend not to wear it. And then the last option is to do your fixed retainer. The fixed retainer is really nice for those patients who don't think they're going to be compliant with wearing a retainer on a regular basis. It's bonded in there, you wear it all the time, you don't have a choice, it just always stays in there. You just need to make sure that you're keeping it really clean. And then we can also do a little bit of a combination of both. We can also make a clear retainer over a bonded retainer, and so sometimes that can be very helpful for patients who want that extra little bit of security. So if you have any questions, please let us know. Thanks.